would like to welcome you to the West Tennessee Bone and Joint Clinic's Total Joint class presentation. I trust that you will find this video informative and very helpful. The Bone and Joint Clinic has 26 providers, and of those, there are 16 orthopedic surgeons, 2 intervention pain anesthesiologists, 1 hand surgeon, 1 podiatrist, and 7 physician extenders. These providers are trained in the following areas: shoulder and elbow, sports medicine, trauma, pediatric, hand, spine, and interventional pain. The clinic has locations to better serve our patient populations in the following areas. We have 2 offices in Jackson, Tennessee. We have an office in Paris, Dyersburg, Union City, Lexington, Bolivar, Brownsville, Huntington, Martin, Selmer, and Trenton, Tennessee. The West Tennessee Bone and Joint Clinic is a past recipient of the Reader's Choice Award for Best Clinic, Best Orthopedic Clinic, Best Physical Therapy, and Best Occupational Therapy. We have multiple staff to provide for your joint replacement needs. You will have care navigators overseeing your medical and therapy needs, as well as a nurse manager, physical therapist, and social worker throughout your joint replacement process. The West Tennessee Bone and Joint Clinic chose to enter into a specialized program with Medicare that is referred to as the BPCI program. You know, in the medical field, we love abbreviations, but we refer to these abbreviations as Better Patient Care Individualized. The clinic reviewed the statistics of this program and looked at how it works to optimize the patient's health prior to surgery, and then it involves close monitoring and strict therapy protocols after surgery. It is for this reason that the clinic and its practitioners entered into the BPCI program to offer our patients an opportunity for excellent outcomes. The healthier a patient is prior to surgery, the better the outcome. As a clinic, we make a commitment to our patients that if they are not healthy enough for surgery according to the guidelines of this program, we will not do the surgery until such time in which the patient is healthy enough to proceed with surgery. I would like to divide this video into basically 3 parts and then have a conclusion that will summarize some important points for you as the patient and viewer to remember. You will be asked to go see your PCP or your primary care provider to have some tests done. I don't want you to feel like you're being given the runaround when you are sent to various doctors, but there are specific tests that need to be run to determine if you are truly ready for surgery. If you are a diabetic, we ask that your A1C level be 7.5 or less. This lets us know that your diabetes is stable and that you are medically ready for surgery. In this program, Medicare requests that your body mass index level, or BMI, be 40 or less. This indicates if you are nutritionally healthy enough to proceed with surgery. So let's say if you are wider than you are tall, then this level might be above 40. Should this be the case, you might be asked to choose a healthier diet to reduce your weight and participate in exercises that you can do in order to help you reduce this numerical level to 40 or less. If you are a smoker, you will be asked to stop smoking 4 weeks prior to surgery. Your nicotine level will be checked right before your surgery, and if you test positive, your surgeon may cancel surgery. We will ask that your doctor do a urinalysis test to determine if you have a urinary tract infection. So many people are walking around with urinary tract infections and they don't even know that they have this because their body may not show outward symptoms of this until it's far progressed. You will also be asked to see your dentist if you haven't been in a while to determine if you have any cavities. So why are we so concerned about a urinary tract infection or cavities prior to surgery? Well, the reason we are concerned about this is because either of these are types of infections, and we need you to be clear of any infections prior to surgery, and we want you to stay free of infection after surgery. Now, why are we so concerned about this? Infections tend to travel to the new joint replacement in your body, so we don't want any infection. If an infection gets in your body and it does travel to a new joint replacement, then you would be looking at like 6 to 8 weeks of IV antibiotics to try to get this cleared up. If we could not get this infection cleared up, then it would result in your new joint having to be removed and allowing your body time to heal, and then looking at rescheduling to have this surgery done all over again. So we definitely do not want any infections. If you have a history of heart issues, you may be asked to see your heart doctor or cardiologist so that they can check you and provide a letter of clearance stating you are medically ready for a surgical procedure. If you have asthma or lung issues, you may be asked to see a lung doctor or pulmonologist so that he or she can determine if your lungs are healthy enough for you to undergo anesthesia. The same principle applies if you have a history of any neurological issues such as Parkinson. You might be asked to see a neurologist so that a letter of clearance can be provided for that as well. Approximately 2 weeks prior to your surgery date, you will be asked to pre-admit at the hospital, and you will be given an appointment time and a location as to the main hospital or the North Hospital where this will need to be done. All of the preliminary doctor's appointments and tests that you have had done will be reviewed during this pre-admission appointment time to determine if everything is needed to complete your surgery. Your surgeon and his team are also reviewing all of this information to see if they feel everything has been done for your surgery to take place. Each patient is given a prescription for an ointment, and this may be called into your pharmacy, so please be sure to check. You will need to swab each of your nostrils in the morning and the evening for about a week prior to your surgery. Please read the instructions on the prescription label. This treats you for the bacteria MRSA. Now you may feel like, well, I'm a clean person, I don't have this bacteria. But if you've ever been to Kroger or you've ever been to Walmart and you put your hands on the handle of a shopping cart and then rubbed your nose, you could have transferred the bacteria to yourself, because this bacteria is on all surfaces in our community. And so this is a way that we treat everyone to make sure that all systems are go on day of surgery. In this program, our surgeons and treatment team make a commitment to you that we will strive to see that you are as healthy as possible prior to surgery, or we will not schedule the surgery. We commit to you that we will follow your care closely with phone calls and follow-up office visits to ensure that you are being monitored closely so that any potential problematic issues may be identified and eliminated quickly. We, however, ask for a commitment from you that you will do the following. Call us first with any medical concerns or health issues and questions. We have someone on call at the clinic 24 hours a day whenever the office is closed for your protection and convenience. We ask that you not schedule any general medical appointments or procedures such as eye exams, eye surgeries, mammograms, colonoscopies, dental work for 90 days post-surgery. This is your most susceptible time to pick up infections and sickness. If you have a family gathering and you know that someone is sick who plans to be there, well, we ask that you rethink going to that gathering. Avoid going to the emergency room, as this is the worst place for you to pick up illness and bacteria. Call us first and allow us the opportunity to address your concerns. Now, with all this being said, if you think you are having a heart attack or you have shortness of breath, then go to the emergency room, because this type of situation would override your exposure to illness. Something else you need to remember: constipation is a real side effect of the prescription medications you will be given after surgery. Plan ahead and have stool softeners and laxatives in your home before surgery. You need to know that each person will be sent home on some type of blood thinner, as this is a prevention for blood clots. If you were on a blood thinner before surgery, you will more than likely resume taking that blood thinner after surgery. If you were not on a blood thinner prior to surgery, you will be given some type of blood thinner for approximately 30 days. You and your surgeon will be the ones to determine what therapy plan you follow after surgery. There are no skilled care or rehab placements for elective surgeries. If you live alone, plan to have someone stay with you for at least the first 3 days and nights after surgery. Most everyone goes home and does outpatient therapy. Statistics show that patients who do outpatient therapy have the quickest and the best outcomes. Part of the therapy is getting up and dressed and going to the outpatient therapy location. It is our goal that you achieve the best possible outcome. There are a few of our patients who will receive home therapy for a brief period of time, but then they will convert over to outpatient. We want to encourage you in this process. We know you will do great. Here are some key points to remember. When you are not up exercising or walking around, be sure to elevate and ice your leg to keep down the swelling. Avoid going to the emergency room and any unnecessary medical appointments for 90 days after surgery to keep you healthy and well. Remember, outpatient is the #1 therapy option that provides you the most successful outcome and the quickest results. Call us first with any concerns, and we do have someone on call 24/7. We are here to help you, and there is a whole team of professionals behind you and working with you throughout your joint replacement process. This video presentation should provide you the needed tools for a positive joint replacement experience. We are looking forward to working with you.